Thank you all. Further debate. The member for Thornhill.
Mr. Speaker, I believe you will find we have unanimous consent to stand down our lead. I'm sorry, I'm a bit hoarse.
The member from Thornhill has requested that her party stand on her lead. Do we have agreement? Agreed. Further debate. The member for Thornhill.
Thank you very much, Mr. Speaker. And I've spoken in the House before about the fact that I'm an optometrist and I worked in a clinic where it was one of my jobs. I'll tell you, it was actually a part-time job for me. I couldn't see as many patients for about 6 months because we were implementing electronic health records, and it was extremely stressful. And I know the Minister of Health and Long-Term Care understands himself sort of the aspect of patients' privacy in terms of the patients themselves, because it used to be you would be seeing one patient and an assistant or staff person might come in with a chart and a question from another patient, and you would sort of discreetly try to look so that the patient in the room wouldn't see what's in that patient's chart. Well, now we have big monitors in the room sometimes, and there's a patient in the chair, and I'm always sort of moving the when I worked as an optometrist, moving the monitor, and it's just as the member, my colleague, just said about an emergency room calling out a patient's name, that even these things are sort of fundamental breaches of privacy, but we have to focus on the need for good quality health care. That's where we want to ensure, and it is a balancing act, as she said, and we want to make sure that the people in Ontario know that they are protected by their healthcare system. Of course, it has to be accountable and transparent, and it has to be private. But we also have to ensure that we're not sort of focusing on the technological gadgets all the time, and we're not keeping up to date with new technologies. And the fact is, Mr. Speaker, a lot of these new technologies require computerization. So as we're developing, healthcare, electronic healthcare records, we have to keep into mind that the technology is moving so quickly that we have to almost anticipate what's the next sort of level of hardware and software and medical treatments that we need to constantly communicate with. So in our office, it wasn't just a matter of putting in electronic health records. It was a matter of having software to talk between diagnostic tests, to talk to the actual equipment of the electronic health care record. And that was complicated and that was expensive, Mr. Speaker, and to the point that we were paying for, and continue to pay in this clinic, upkeep, sort of software support, it's called, of 3 different companies, because they're all interacting and talking to each other. And you could see how, for security issues, how complicated that is. And I would say it's very similar to the banking system, where people now, who anticipated 2 years ago that you would be able to take a picture of a check with your smartphone and have it deposited in your bank account. Well, with all these new technologies, yes, it simplifies life. And as the minister just said, whose son now works in medical records in a hospital, that it's saving space, and space is very valuable because hospitals paid for the space to store all those records and paid for staff to file those records and to retrieve those records and searching around looking for those records. And one of the best parts of electronic health records is the fact that when you have a paper chart, Mr. Speaker, only one person, only one healthcare professional can be looking at that chart at that time. And now with electronic healthcare records, multiple people can be looking at the same chart at the same time in different aspects. Because a patient could be having an appointment in one part of the hospital for a test, but another clinician or staff person needs to access that record for another purpose. So right now, though, we have a fairly fragmented healthcare system, and I think that I've said it before, so I apologize if I'm repeating myself, that we've all known in the healthcare profession that Alberta.net, they call it, has a fantastic e-healthcare system. And all we had to do was go to Alberta, our friends, and say, well, you're very similar healthcare system for the province. The delivery system is very similar mandate. So I can't imagine why we couldn't have at least made the effort. I've never received an answer, not that I asked formally in writing, but I've never really received an answer from this government of why we didn't just call up our colleagues in Alberta and say, well, you have this real state-of-the-art system. You've worked out all the bugs. The physicians are all integrated into the system. The hospitals are integrated. The diagnostic testing centres are integrated. Everybody's saying that, it took a few years to really work those bugs out and get it working, but what would it cost us to implement it? Obviously, it wouldn't have cost us as much as it cost Alberta to set up the whole e-health, and it certainly wouldn't have cost us as much as we spent on our e-health that never achieved its goals. So it's a double shame, Mr. Speaker, because we can't just say, well, we tried, when there was a e-healthcare system in Alberta that we could have borrowed, rented, purchased. We could have even paid the Alberta specialists to come and implement it and train our specialists. So I found it very heartbreaking on a personal level because of the colleagues that I would see at conferences from Alberta, and they would talk about the complications, and actually many of them said that they already had purchased e-healthcare systems for their office that they had to basically throw in the garbage and start over again, and they weren't complaining. They said even though that $50,000 or $100,000 to implement the electronic healthcare records, even though they had to spend that money, they're not complaining because the new system was working so well. In 2014, there were 439 cases reported to the Information and Privacy Commissioner's Office. And what's interesting is that since reporting isn't currently mandatory, and this bill is going to address that, which is obviously very necessary, we don't really know what that number is if it's not mandatory. And we all know that people don't tend to report things unless they know they have to. That's just kind of human nature. And, it's also human nature, even though it's professionals in hospitals, to try to access a celebrity. Rob Ford was a politician, but he was also a celebrity, and the fact that 3 hospitals had breaches of his electronic healthcare records because people were snooping. And you could see why people are snooping, sometimes just to gossip to their friends or for their own information, but they could also be selling information to the media. And just like I said about banking, we have to ensure that it's not enough that physicians are perhaps having electronic healthcare records on a laptop which they take to a conference and might be stolen. And just a few years ago, we read in the newspaper of electronic healthcare records that disappeared, being stolen from cars or being lost just from laptops that weren't encrypted. And, it begs to mind the question that physicians who obviously have to have a very high level of intelligence to be physicians, that they wouldn't understand the dire consequences of carrying around all their patients' records on their laptop and not even have a sort of password to get into it, the most basic. But we all know that if somebody really wanted to get through a password on a laptop, or they could do it. There's enough talented people. If people can break into banking systems and things like that, well, we know that there's nothing foolproof, but we can do our best to ensure that the patient's records are protected as much as possible. I reached out to the College of Physicians and Surgeons, and they said that they're looking forward to, better protection of patients' privacies, but they mentioned a few concerns, and mostly about clarifying and the reporting obligations, and the new provisions of, how to report privacy breaches. And they suggest that the language be made consistent with the mandatory provisions in the Health Professions Procedural Code. So that's what has to be looked at, is that, whenever we do new legislation, how does it interact with previous rules and regulations of not just the government's bills, but also all the colleges that are affected, and hospital protocol. And we understand how complicated that can be, Mr. Speaker. There was actually just in this month's medical review, which I'm sure the minister receives from the OMA, there was an article about Bill 119 summarizing basically for their membership. And they mentioned something that I haven't heard mentioned yet today, which is that the bill, they expect the bill to have an opt-out system. So that's kind of like negative billing, which means that patients are automatically in the system unless they ask to opt out. And again, it comes down to sometimes individual rights and freedoms versus the collective and the community, the needs of the community. And we see that with vaccines, all the discussion of vaccines now, that people feel that ideally their child shouldn't have to be vaccinated, but everybody else's child should be, and then their child doesn't really need to be vaccinated, and we can understand that. But if we want to use the information from healthcare records for studies, to see if there's side effects from certain medications, we all understand that the incredible ability of computerization is that you can even do searches and say, do a search of all the healthcare records of everybody on this medication who has this symptom, and it's very possible that things could come up. There's also the aspect that patients sometimes go to multiple doctors, and one doctor doesn't know that the patient is seeing another doctor. They go to multiple pharmacies, and they might have medications that they don't know want one doctor to know about other medications, and that creates problems for the doctors, and ultimately the doctors are responsible for the health care of the patients, and it puts them in a tough bind sometimes, because if they don't have all the information in front of them, how can they possibly make informed decisions on their patients? I'm just looking here at, again, the incredible system that Alberta has, and sort of wondering why we're not doing more than just protecting the privacy of patients. Why aren't we finally addressing the fact that Ontario does not have a state-of-the-art electronic healthcare record system? eHealth spent over $1 billion, and actually for years we heard that, yes, the eHealth part of it wasn't implemented, but there was going to be a registry of diabetic patients in the province, and we were going to be able to do great research and information exchange, and even that didn't get done. So it's not enough to say, as one of the ministers stated, to say, well, what's in the past is in the past. That's not good enough, Mr. Speaker. We, as the government, even in opposition, it's our responsibility to ensure that the taxpayers' money is used wisely and used for the purpose that it was intended. And it was intended that patients would have not just electronic healthcare records in their physician's office, not just electronic healthcare records in a hospital, but that all of the different systems were going to be able to interact. And they do not interact right now, Mr. Speaker. I've, interestingly enough, gotten a few calls in the last couple of weeks from physicians who say that they have stopped receiving the government payments to cover the portion of their investment for electronic healthcare records. I'm not sure, I haven't had the opportunity, but maybe now it's an opportunity for me to ask the healthcare minister what's happening with compensation for physicians for private clinics. One physician that I spoke to just this past week said that two of the specialists who work predominantly at sick kids who come to his pediatric clinic in Richmond Hill, they only work 1 day a week, sometimes 1 day every 2 weeks. One is an allergist, and I think one might be a rheumatologist, pediatric allergist and pediatric rheumatologist. And they say, well, if we're not receiving that $300 or $400 a month to cover our share of your electronic healthcare records, we just want to go back to paper records. And what I said to this physician is exactly, I said, come on, they're not going to really want to have paper charts in your office. And I said, I'm sure that you could give them a piece of paper, and luckily enough, a lot of paper does still go through medical offices, but what happens to it, Mr. Speaker, is it gets scanned and it gets uploaded as an attachment to the electronic healthcare record. So, yes, we can't say that these offices are paperless because the fax machines are coming in with referrals and things like that, but at least they don't have to pay to store those charts and they don't have to look for those charts all day long, because it's very frustrating as somebody who spent many hours in my former profession looking for patients' charts. There's nothing worse, and as somebody who worked with her husband, it's probably was the most stressful part of working with my husband in a medical clinic. Was he would accuse me of having the chart and I would accuse him of having the chart, and invariably, Mr. Speaker, it was me who was at fault. So I have to say that those charts pile up, and somewhere in there is the chart that I should have put for refiling. There's, I think, a question among patients about accessing their records if they move out of the province. And that's always a very big question and a problem for many patients. When they move out of the province, how do their records get access? Are they going to be able to get a printed copy or an electronic copy? Right now, a lot of diagnostic tests like even MRIs or ultrasounds are put digitally on a DVD, and the patients have to go pick it up from the hospital after a radiologist has viewed it and actually transport it to another hospital where they have an appointment with another specialist. So that is an incredible waste of people's time. It's an incredible waste of money because they have to, put it on a DVD and then bring it to another hospital. And when you have a great system like Alberta, and even Newfoundland supposedly has a better e-health system than we have in Ontario, which is quite shocking, Mr. Speaker, that's not what the digital age is all about. It's a little bit like us here in the legislature, that we're not using electronic devices. It's sort of a very historic place here. It's about protocol. It's a bit old-fashioned, I guess, for most people, but it's not the most efficient place. And I'm sure that the people at the Hansard desk would love it if, instead of sending around pieces of paper to them, we would just press send from our device, and we would send them our notes, and they could just upload it. And that's exactly how healthcare systems are supposed to work. It shouldn't be patients picking up DVDs from one hospital to bring to another hospital, as is happening in downtown Toronto right now, because I know even very recently that patients had to take from Mount Sinai to a nearby hospital, pick up a DVD, and I'm just shocked when I hear that kind of thing, Mr. Speaker. There's duplication of services because if patients are seen in an emergency up at their cottage at the emergency room and have a test done, when they come to Toronto and they say to their doctor, well, I had a test done, the doctor says, it's easier for me just to reorder the test and send you to redo the test than it is for me to access that information. So that's a waste of healthcare dollars, and I think that that's sort of what it's all about, is that, yes, it's very important to spend the money updating the privacy and of electronic health records. It's even more important to make sure we have a state-of-the-art electronic healthcare record system at the same time. I don't know why we're just focusing on one aspect of e-health instead of just revamping the whole thing. But this is part of the problem, Mr. Speaker, is healthcare dollars, too much is being spent on bureaucracy, and invariably patients understand that rent has to be paid and staff has to be paid. But with a real state-of-the-art electronic healthcare record system, patients' privacy could be protected, the efficiencies could be there, and yes, it's an initial investment. We see how expensive it is. Maybe it's not too late to ask Alberta for some support or help, but most hospitals now have electronic healthcare systems in place. The problem is that different hospitals have different systems, and yes, the doctors' offices who are part of the government-approved system to get support funding have to be on specific, healthcare, electronic healthcare record companies. They have to. I think there were 5 companies they were allowed to use, but there are still many physicians who are using outside of that loop. They're not getting any government support or funding, but they're using electronic healthcare record systems that are not able to be integrated into any kind of healthcare system that we implement here. And I think that that's one of our concerns, is that, yes, we can oversee the privacy concerns of any healthcare record system that is integrated and in the loop for the government, but what about all these private clinics where, you know, people have basically, they just make a Word document and they call that an electronic healthcare record, and they type into their computer, and maybe it's a bit old school, but they feel they're retiring in a few years and they don't feel like investing $100,000 in electronic healthcare records. And I think that I've pretty much covered what I wanted to say today. Thank you very much, Mr. Speaker.
Thank you.
And I look forward to the comments.
Questions and comments? The member for Welland.
Thank you, Speaker. And